Welcome back. This is Dr. Jin Sung, and this is week number 30. Last week we did a seminar series on adrenal function, adrenal fatigue, and we had a great response with that. Today we're going to talk about the web of physiological dysfunction. So when we look at your health, we have to look at it in terms of a web. There is no direct correlation as in terms of I have a symptom and one organ is causing everything. It's usually a physiological web. So one thing affects another, and then goes back in a loop. So when we look at a patient, so let's take an example. We have a patient who initially says, I'm feeling a little tired, I'm a little run down, and they go to see their primary care physician. So when the primary care physician will sit down with them and chat with them for about, 5-10 minutes, and they go, let's run some routine blood work. Blood work comes back and their cholesterol is elevated and all the other markers look good, according to the doctor, right? So your cholesterol is, let's say, 230, and you're a female. They go, well, it looks like your cholesterol is high. I don't see anything else wrong with you. We're going to put you on a cholesterol-lowering medication because cholesterol causes heart disease. In actuality, it's not cholesterol that's the problem. So they put you on a statin medication, and what happens is the statin medications will start to deplete some of the coenzyme Q10 in the body. So coenzyme Q10 is an important nutrient that helps with mitochondrial function or energy production, right? So you go in tired, and then they give you a medication because your cholesterol is a little elevated, and then the medication itself makes you more tired because it depletes coenzyme Q10. It also creates, for some people, some muscle pain and joint pain. So let's say you get on the cholesterol medication, I feel worse, I'm tired, I have now muscle pain, I have joint pain. Well, Mrs. Jones, along with the statin medications, you can go ahead and take some ibuprofen, right? You take ibuprofen for a couple of weeks, 3 weeks, 4 weeks, and I feel worse, right? Because maybe your liver enzymes are starting to go up because it's being affected by the medications, right? You go back, your liver enzymes are elevated, and they go, hey, there's something going on here. What are you doing? Oh, you got to stop your pain medications, and now you got to go see a specialist. Make sure those enzymes come down and so forth. So you end up in this box of going from one doctor to another, right? So let's say I give you another example. A person comes in, they have reflux disease or GERD or gastroesophageal reflux disease. Oh, my stomach is not doing well. I get this reflux symptom when I eat, when I lie down, and so forth. The first thing they prescribe to you is a antacid or antiacid, right? And then your stomach might feel a little bit better, but you start to feel tired because antacids block the absorption of nutrients, your B vitamins, your iron, and so forth, right? So you start to get nutrient deficiencies almost, right? And then you start to feel tired. And then you have iron deficiency anemia. They give you iron, rather than saying, hey, maybe the antacid is causing the problem and you're not absorbing your iron, right? So the traditional medical model currently is you have a symptom, you have to take a medication. You have a symptom, you take a medication. You have a symptom, I don't know what's going on, I'm going to send you to a specialist, right? And then you go in this box, going back and forth, specialist to primary, to specialist to primary, to testing, and so forth. But the answers in the medical model is still the same. Either you're perfectly healthy, there's nothing wrong with you, your symptoms are, we don't know exactly why you're having those symptoms, but your blood work looks decent. It's good, right? But they take the ranges in their lab, and they're just looking for pathology. They're not looking for function. So if you look at a healthy individual, that broad lab range doesn't really correlate very well. If you want to be healthy, you need to narrow that blood range down to a smaller range where healthy people tend to live, right? So you live in a box where you go from doctor to doctor, medication to medication, specialist to specialist, imaging to testing, and so forth, and it's in this little box. And of course, you expect that your insurance will pick up everything. It'll pick up the cost of the entire treatment protocol, right? But meanwhile, you're wasting time, you're paying co-pays, your deductibles, right? And you're going back and forth to doctors and so forth, and your health is not getting any better. It's actually getting worse because you're taking so many medications, it starts to affect you, right? When they do these studies on medications, it's not I take one medication and I take another medication and what is the reaction? It's just one medication and what is the reaction, right? You see the commercials on TV, right? You see some woman running down into the fields with the flowers and so forth, and there's some drug, and it's supposed to help with, let's say, immune dysfunction or autoimmunity or autoimmune disease. Yet at the end of the commercial, some guy speaks at 1,000,000 miles an hour and names off like 30 things that can happen because of the medication, right? What if you took 2 medications? You don't double the symptoms or adverse effects. You multiply it because you don't know how those 2 drugs interact. Oftentimes, when you take 3, 4, 5, 6, 7 different medications, you don't know how these medications are interacting with one another and how that patient is feeling as a result, right? And then you expect the insurance to pay for all these medications and so forth. Meanwhile, you're wasting your time. You're wasting your precious time, months, years of health that you could have recovered if you went down a different pathway. So I invite you to step outside of the box. Step outside of the symptom-based care that you are in. Step outside of the medical model that you are stuck in. Stop thinking about the co-pays and deductibles and all the other stuff. You might be better off just paying for your care, getting better faster, and still spend less money, right? So when we look at a patient in the office, we look at a physiological web. What is affecting you? And how does that affect other systems in our body, right? So let's say a patient comes in, they have fatigue. So we may run a adrenal profile on that patient. We might run a stool pathology test because gut dysfunction can create fatigue. We might run thyroid antibodies and thyroid testing. We might run hormone panels, right? We might run a complete blood lab to look at all your different markers to see how healthy you are, right? We might look for infections. It might be Lyme's disease, chronic viral disease, Epstein-Barr, and so forth. We might look at just sugar dysfunction. Is my sugar in balance, right? A thorough consultation can decipher what tests need to be run. You don't need to run every single test under the sun to figure out what's going on. It really starts with the consultation. A thorough consultation, thorough questionnaire, dietary intake, nutrition, and whole food nutrition is the best way to go. So if I got someone with fatigue in our office, it starts with the consultation and trying to figure out which tests we need to run, right? Sometimes I have patients, they come in, they're fatigued, they've been to multiple doctors, they run a bunch of tests, they don't have Lyme's disease, they've been to a naturopath who also tends to maybe just say, oh, you have this symptom, try this mitochondrial support, right? Oh, you have anemia, here's a iron supplement, right? We're not in that business of chasing symptoms. What you need to do is get to the underlying cause. How do we figure that out? Proper testing, proper consultation, and an in-depth questionnaire, right? Questionnaires that go over all your symptoms, all your systems, right? And trying to figure out and narrow down where do we need to go. So I'll give you an example. I had a lady come in. She's been to other doctors and other naturopaths and other functional medicine practitioners, right? And they've been on like different medications, different supplements, and they've been doing all this stuff, and it's not working. And one of the telltale signs that I saw in her questionnaire was that she was bloated all the time. Right? I eat, I bloat. Right? I run, I bloat. I can't get rid of the bloating. It turned out she had something called SIBO, a small intestinal bowel overgrowth, right? SIBO is when your natural flora in your large intestine sneaks into your small intestine and it creates bloating. So normal flora that's in your body migrate into areas where it should not be. SIBO can create fatigue. SIBO can create nutrient maldeficiencies. SIBO can create brain fog, right? So what did we do? We ran a test, figure it out. We checked for SIBO. And sure enough, she had the methane gas for SIBO testing. So when you look at the people who have different symptoms, it's important to pinpoint, right? Don't chase symptoms, pinpoint the underlying issue, right? Once you can do that, you can have a hormetic effect. What that means is, instead of chasing down all these different things and symptoms, you say, I'm going to go right here, and that should have a global effect that cascades out and helps all these symptoms, right? The first place for most patients who start in our office, it's the gut, the stomach, right? The gut is so important to physiology, so important for immune function, nutrient absorption, neurotransmitter production, right? It is so important that we usually start in the gut because it can have a hormetic effect. It has a very global effect if you can have GI dysfunction corrected. But it's not just the gut, right? Because the gut, if you have a gut problem, it can affect the thyroid, like food sensitivities, like gluten. If you have gluten sensitivity, it may affect thyroid, right? Gluten sensitivity also affects the brain in terms of the cerebellum. So you have to look at it in terms of what is the underlying cause and correct a few things and let the body work, right? So if you have fatigue, don't just say, it's just one thing. If you have iron deficiency and you have fatigue, then you have to say, why do I have iron deficiency, right? Is it because I'm bleeding inside, right? Is it nutrient malabsorption? Is it a parasite? Because parasites love iron, right? Especially H. pylori, Helicobacter pylori, loves iron. So if you have those underlying causes, you got to get rid of them. So in order to correct iron deficiency, which will correct the fatigue, right? So we don't give you iron in this office. We say, why? Then we look for maybe H. pylori. And then we find it, and then you eradicate it. So if you eradicate H. pylori, then the iron deficiency will go away. So it's so important to look at the patient in terms of how they function, what is the underlying cause, and then try to attack one or two areas that can have a global effect, rather than chasing symptom after symptom after symptom. It's usually not a nutrient deficiency. Here in the United States, you get plenty of nutrition, you can get plenty of nutrients. It's sometimes just the wrong type, right? You have all these supplements and the supplement companies. When you go to, let's say, Walmart and you buy fish oil for like $6 and it's got 2 million fish oil capsules in there, you think that's a good quality fish oil? You think they can produce that much? Right? Most of it is fillers, right? It's not even the good EPA DHA that you want. It's mostly fillers. So you have to ask yourself, am I even getting the nutrients that I need? Is it the correct form? Do I have a physiological dysfunction anywhere in our body? And can I correct it by doing just a few things? The few things should be eating a whole food-based diet, right? Fresh fruits, veggies, organic meats, and so forth. That's your basis. And then you work your way out. Okay? Because oftentimes, if you just fix the gut, things tend to get better. If you fix the gut and the liver detoxification pathways, things start to get better, right? If you have brain fog, it may not be the brain. It might be a gut. It might be an infection, right? Lyme disease can mimic a lot of different things. Lyme disease can affect or mimics things like Alzheimer's disease, right? So it's important to check for those types of things. So I challenge you to do the right thing, right? Start with a whole food-based diet and then work your way out. Because one thing affects everything, right? If you have a little pebble in your shoe, right? Initially it's just uncomfortable. Then it's painful. Then you start to limp. Then you start to have hip problems. Then you have lower back problems, right? And so forth. So that little pebble in your shoe can have a global effect, right? And vice versa, if you can do a few things to help yourself in terms of your health, then it can have a global effect. So what you need to do is look at the underlying causes. What is causing my problem, and how do we get to the bottom? All right? So next week, what we're going to do is we're going to look at our office. I'm going to give you a little tour of my office and show you all the different things that we use in our office to help patients. We're also going to talk a little bit about brain function and so forth in coming weeks, because we don't just do functional medicine in our office. We do physical medicine and so forth, but another big part of it is functional neurology. So we do a lot of functional neurology to integrate the brain. It helps things like ADD, ADHD, Alzheimer's disease, neurological disorders, tremors, and so forth. So there is another part of our practice that we didn't really talk about, and this is functional neurology. And in the coming weeks, we'll talk about that a little bit more. But next week, we're going to do a little office tour, and we'll see you guys on the healthy side. And my name is Dr. Jin Sung, where clinical excellence meets excellent results. See you next week.